Hi, I'm Dr. Rajdeep More, consultant gastroenterologist at the Gastrocure Endoscopy Center and Liver Care Clinic in Thane. So what is pancreatic cancer? Let us talk about pancreatic cancer. So pancreas, as you know, is an organ in the upper part of the abdomen. It is located behind the stomach. It secretes a lot of pancreatic juice. Now, the pancreatic juice is responsible for digestion of proteins, fats and the carbohydrates in your diet. The pancreas also secretes insulin, which is very important in controlling your sugar levels or the glucose metabolism. So now, how does pancreatic cancer develop? So what are the risk factors for pancreatic cancer? The commonest risk factors are a patient who has a family history of pancreatic cancer, then family history of some syndromes which cause genetic mutations such as BRCA2 gene, history of, usually it is found that patients with pancreatic cancer have history of smoking, diabetes or obesity. Another very important risk factor for pancreatic cancer is an underlying history of chronic damage to the pancreas, also known as chronic pancreatitis. So how do you come to know that a patient has a pancreatic cancer? What raises the suspicion? So the signs and symptoms include significant weight loss, severe abdominal pain or in the upper part of the abdomen which is radiating to the back, vomitings, weight loss. Patient may even develop jaundice, itching over the skin. The color of the stools may be pale because of lack of digestion of the fats. The stool may be very high colored because of passage of bilirubin in your urine. So these are all the probable signs of pancreatic cancer which should be looked out for. Now, how do you go about testing and treating patients with pancreatic cancer? So, the routine tests with tumor markers, routine tests such as hemogram, LFTs can be done to see if there is jaundice. Apart from that, there are some tumor markers called as CA 19.9, which may be elevated in patients with pancreatic cancer. We have a lot of advanced endoscopic modality, which is known as endoscopic ultrasound guided biopsy of the pancreas. Which is a latest technique used to diagnose whether there is pancreatic cancer. So what we do is we do an endoscopic ultrasound and take a biopsy from the pancreas. So that is how a pancreatic cancer is diagnosed. Then next, if the patient has jaundice or if the pancreas presses on the bile duct, then we have to do procedures like ERCP, endoscopic procedures, to stent the pancreas and to stent the bile duct. Now, how do you prevent or how do you avoid getting pancreatic cancer? So, when you have the risk factors that you've already understood, it is important to avoid or quit smoking, maintain a healthy lifestyle and diet, have a diet rich in fruits, vegetables and whole grains, which acts as detoxifying agents or antioxidants, and regular screening if you have a pancreatic cancer history in your family, or if pancreatic genetic mutations are there. Genetic counseling and genetic tests are also available. Those should also be done. Regarding the treatment of pancreatic cancer, so there are surgical treatment available. There is chemotherapy available. Depending on which stage of the pancreatic cancer you are, that has to be taken forward. So always do consult your doctor whenever you come across or whenever you feel that there is you have been diagnosed with pancreatic cancer, because early diagnosis is very important in having a good prognosis and having a good outcome.